it's essential for people to do certain things every day. It's impossible for an entire country to remain, within the parameter of their house for 3 weeks or 6 weeks or whatever. But I think as public, we have to start policing. So when our sabji wala comes in the morning, into the lane or whatever, and it's a free for all around him, we have to start policing, because spending 24 hours in your house, and keeping your family indoors, but then getting down for that 2 minutes in the morning and crowding around that vegetable trolley has defeated the entire purpose. So we have to start policing these methods.
Okay. Well, there are a couple of questions on society behavior, Dr. Aayesha. People are asking, when they're staying in a society of apartments, they are seeing people come down and play within the society compound,
right?
Which is isolated. So the question is that advisable or not?
Well, it's very difficult to say that it's advisable, because as we understand, our international and domestic flights have just stopped a few days ago. We know that a lot of the people, and some of these societies have thousands of residents staying together. A lot of them have people in their households who have traveled recently, or have contact with recent travelers and things like that. And that's what I mean by breaking the chain of transmission. So if you can keep your children and your families away from each other for that 14-day period, and we've stopped international travel, domestic travel for that 14-day period, I think that should go a considerable way in breaking that chain.
Okay. The other question people were asking is, once you've recovered from the infection, can the infection come again?
So there is some evidence that people, despite having had antibodies to the infection, have, repeatedly developed symptoms or whatever. But these are just anecdotal events from anecdotal reports from Hubei and other parts of China. There's no clear evidence on it, but we're hoping that there will be some partial immunity, at least temporarily. In fact, that's the importance of doing antibody tests. So when you say you do antibody tests, it's very important for us as healthcare workers who get exposed repeatedly to check and see if we have antibodies. And, if we do have antibodies, then that we're hoping that puts us in a safer position when we're in contact.
Okay. The other question on the lockdown, people are asking whether it's 14 or 21 days, is even post-lockdown, if there are cases that come out, then does it defeat the purpose, or you think that we'll go into a situation again?
Without sounding pessimistic, yeah, definitely. I don't think that 21 days is the solution. We'll probably have to extend it longer. I don't know how this is possible. But again, what we're trying to do is we're just trying to blunt that curve. We're just trying to see that in the next 2 weeks, we don't hit such a high that we are completely overwhelmed and we have no way to, move forward. Pretty much what we're seeing in the US at this moment, where they're actually contemplating do not resuscitate orders universally for COVID-19 patients. So they've come to a point in their health system with their thousands of ventilators and critical care equipment. Universities are actually asking for laws to be passed so that the healthcare system can breathe and doesn't get overwhelmed, not to resuscitate patients who have critical illness with COVID-19. So, and that's happened because of the number of cases that have risen in so short a time. So these lockdowns and all are only it's not going to take things away. It's not like it's going to, it's wishful thinking to think that May will come in and then the summer will be here and it'll all be over. I hope and pray, but that's really wishful thinking. But it's only so that instead of having to deal with 40 lakh critically ill patients in the next month, we might have to deal with 2 lakh or 4 lakh, and our mortality rates might be lower.
Okay. The other question is on the from a home health service company which is sending nurses and care attendants to home, and they are asking what additional precautions they can take.
So they're
for their
sending
own,
nurses and healthcare professionals home for
senior citizens, and they're saying that they're getting more and more queries from these people for
right.
home care.
So these are the regular nursing bureaus and things that just go to look
Yes,
after senior citizens.
yes, yes.
Yeah. So I mean, it's difficult to say, but by and large, I think the bureau or the company that's doing this has to establish a very thorough history from the patients and their relatives as to what has been the status of this patient, the relatives that are currently caregivers, any contacts, and then adequate precaution has to be taken by the staff that is attending. So if see, definitely the senior person looks unwell or appears to have any sort of febrile illness, that needs to be reported immediately and looked into. And these workers need to sort of be, the nurses and the healthcare providers need to be trained as to sort of look out for these things and protect themselves. But
Okay.
it's not a simple solution. We can see how difficult it is in a hospital setup where you have trained staff constantly dealing with it. It's so difficult to cohort a suspect from a non-suspect. We will move into a stage in the next couple of days where everybody will be a suspect, but at the moment that's proving to be very, very difficult.
The other news people heard was there is this malaria medicine which is being
Right.
prescribed.
Before I go there, another suggestion is that if somebody has to be sent from a healthcare bureau or whatever, I would suggest that it's somebody who's sent there on a permanent basis to live there, and not a different person every day who has to travel up and down, because that again just increases the number of people who are coming into contact and traveling and whatever. So that's something we're trying to minimize.
Okay. So the other question I was asking Dr. Aayesha is this malaria medicine, which is being prescribed. What's your view, or if there's any evidence that it's going to work?
Are you asking for treatment or for preventive?
For treatment.
Care? For treatment, right. So there's exactly 2 studies, all right. None of them are any quality papers. And that's natural because one hasn't had the time right now to do what we call randomized control trials, double-blind randomized control trials, which are accepted to be the norm in medical parlance before you actually, accept a drug as having efficacy for a certain condition. The one trial that is being quoted repeatedly, on the basis of which the hydroxychloroquine has been suggested by the US authorities, is a trial done on 26 patients. All right. By and large, if we look at things from the past, we have seen more often than not that these trials prove to be, completely inaccurate and of no real standing once you look at it with larger numbers and statistical significance. However, given that there is nothing else to offer at this moment, and that in theory, hydroxychloroquine does have some antiviral effect against the beta coronaviruses, in really sick people who, are sort of going into what we call acute respiratory distress and going to require critical care and stuff, we see that given that the drug, using the drug might be, an option in them, but really nobody in the medical community is convinced as yet that this is, in any way curative or in any way highly efficacious at all.
Okay. The other question people were asking is, we are still seeing the spread. So is this an airborne spread only?
So that's a very important word, and it needs to be used very carefully. Medically speaking, these are technical terms. Airborne is not the same as a droplet infection. Yeah. And when you say that COVID, like H1N1 or swine flu, is a droplet infection, we mean that unless you're within a 1 meter distance of a positive patient, it's unlikely that you would, um, be infected. And that's because droplet infections spread by larger respiratory droplets that are coughed and sneezed out. When we call a disease an airborne infection, we're talking about something like tuberculosis, wherein when the person coughs and brings out secretions, there are very tiny droplets, less than 5 microns, which remain suspended in the atmosphere. And those can spread over a distance of several meters and remain suspended in the atmosphere for several hours. So we make a very strong clinical distinction between what is a droplet infection and what is an airborne infection. I know that lately there has been some talk about the coronavirus COVID-2 being an airborne infection and remaining suspended in the atmosphere for up to 3 hours. And there's, been some reports and some CNBC talking about it and everything. From a public perspective, this should not be an area of worry at all, because aerosolization of these particles is highly, highly unlikely in the community when somebody is just coughing. All right. From a healthcare perspective, this is important because when you put a patient on a nebulizer or you intubate a patient when you're going to ventilate, that is when you generate a lot of aerosols, and those aerosols remain suspended in the atmosphere of the wards and the ICUs, and that's what causes infection in the healthcare workers, although they are in their personal protective equipment and all. So from a healthcare perspective, it assumes a whole different significance. But in the community, if you can maintain social distancing and keep away from other people, infected or not, even masks, a surgical mask is not suggested for everybody in the community. It is only suggested for people who are coughing and sneezing so that their respiratory droplets, are contained. But for everybody else, if you're maintaining social distancing and you're ensuring that you're not, in close contact with other people, then this is not of significance. It's a droplet infection. You have to be careful of maintaining a distance and meticulously hand washing after you touch any surface or come into contact with anything that is in a public place.
So somewhere there have been reports that the virus lasts for 14 to 16 hours on surfaces. Dr. Aayesha, elaborate on that.
So these are the same studies that you're reading, which I'm reading. We have no way of studying these things ourselves. And
Okay.
there are some studies which have discussed how long it stays on cardboard and metal and plastic and all sorts of things. Again, brings us sort of back the entire circle, despite all our medical advances, to a very simple philosophy of just meticulous, repeated, and thorough hand washing. It doesn't matter if you don't have access to a hand sanitizer. Everybody has bought them out like crazy. Please just use any regular soap, Lux soap, whatever, Palmolive soap, whatever you have. Wash for 10 to 20 seconds, scrub between the fingers, scrub down the nails, and do that repeatedly. So if you're worried about taking parcels, accepting courier, going down and buying groceries and things like that, ensure that while you're doing those things, you're not touching your face at all. And the minute you come up, before you touch any other surface in the house, you've gone straight into the washroom and washed your hands thoroughly.
Aayesha, we have a lot of situation where our own family members have come in from overseas and they are right now at home. Is the 14-day period a sacrosanct period? And if they have not shown symptoms for 14 days, does it mean that they are safe, or what should we do?
By and large, they're saying 97% contract the illness within 14 days. So very few actually will be infectious, even if they're asymptomatic after that. So yes, I think 14 days is a good enough period. The problem lies that most people are not observing that 14 days. The infections that we're seeing in the hospital at the moment, coming to the private hospitals, are all people who defied those 14-day isolation rules, who transmitted the infection to elderly family members. We just had a case last night. We lost an elderly family member because a young grandson had come in from abroad and not maintained the quarantine rules. The grandson is asymptomatic, but he's positive.
There's a lot of literature going on around camphor uh, in prevention. Uh, is there any
No,
medical
I
view?
have no. I mean, I'm sorry.
No, no, I
I've
understand.
read about
Yeah.
these things, but camphor comes as one of the myths and stuff. I really don't know, about camphor. Not
The
sure.
the the other thing is, Dr. Aayesha, we wanted to ask is today if there are any person in the house,
Hmm.
especially elderly people who are
Hmm.
showing certain symptoms, how do we differentiate them between normal symptoms and COVID-like symptoms?
So it's very difficult to differentiate. And I was just reading a post from an Indian ER doctor in New Orleans who's actually written that there are myriad presentations. We also know that the elderly present atypically, all right? So some elderly people may not mount a fever. Although this illness, what we are looking for predominantly, if someone's just talking about a sore throat or a little cough, we're saying, do you have fever? Do you have fever? Because fever seems to be the most common symptom. Having said that, we as doctors, we understand that with most other illnesses, elderly people can present atypically. All right. So, according to me, um, I mean, this is not a situation to sort of panic in and jump at the labs and all are going to be overwhelmed if all of us just keep doing throat swabs, for every little thing. But I think that as soon as somebody starts having symptoms, everybody else in the household has to be very, very cognizant about isolation. So the person with symptoms has to be given a mask. There has to be only one healthy young family member who attends to them, gives them meals, carries away their linen, washes it separately. So, keeps them in isolation. If you don't have a separate room for them, at least try to maintain as much distance from the person as possible and watch for about 24-48 hours. If fever comes in and the cough is becoming progressively worse or whatever, then clearly they need to have their testing done. And in time, when there is more and more access to tests, and if there is profound community transmission, then depending on what the policy is, we'll probably have to swab everybody.
Why is it just the face being singled out on touching? Are the other parts of the body not exposed, or is there risk of infection lower there?
Again, it's a droplet infection, no? So it's spreading from your facial orifices to somebody else. It's unlikely that if the COVID patient kicks you with his foot, that you're going to get it, unless that's not
Hmm.
the way it's going to spread. As of now, they don't even feel that it spreads through a fecal oral route, which means it doesn't spread through food, contaminated food, which has been handled by a sick person. So there's very little evidence for that as well. So at the moment, primarily it spreads through the respiratory secretions.
Okay. There's another question on calcirol
Mm-hmm.
sachets,
Mm-hmm.
which people are talking about to take for 6 weeks. So, is there any medical evidence against that?
So calcirol is nothing but vitamin D. All right. There are a lot of people talking about boosting your immunity with zinc, with magnesium, with vitamin D, vitamin C. All these things are harmless if they're done in proportion. Of course, if you're going to go crazy taking all these things, you're going to get hypervitaminosis and actually poison yourself with it. But these are just immune boosters. I don't think that taken rationally they can't do any harm, but there's no proven benefit. Vitamin D has been known to sort of reduce other respiratory infections, so has vitamin C. But again, no direct evidence, no studies coming forth as yet.
The other question is, should eating raw food be avoided?
Uh, if you can, you're talking, for example, let's say a salad. As I said, we haven't yet had any hard evidence of it being spread through contaminated food. However, if you have to sort of have a salad, ensure that you're cutting and doing it yourself and that it's well cleaned and that you've soaked it for a good enough time in salt water or whatever that you would generally do, but be more cautious with it.
The cough that people get, Dr.
Mm-hmm.
Aayesha,
Mm-hmm.
there's something which is a dry cough and a wet cough. So,
Mm-hmm.
what is the COVID symptom? Is it dry or wet?
Characteristically a dry cough, though some
Okay.
people, as they develop a pneumonia, might sort of progress to a wet cough with sputum, with actual expectoration of sputum, bringing up purulent material from your throat.
And is there shortness of breath as well?
Shortness of breath is actually a warning sign of impending, sort of worsening pneumonia. So definitely, on the way the illness evolves is that from day 1 to day 5 or 7, it's just fever with a dry cough. And then the warning signs which come up somewhere between day 7 and day 11 are shortness of breath predominantly, drowsiness, confusion, dizziness, extreme lethargy, high grade spiking fever, dehydration. So all those things are actually warning signs that medical attention is required. Yes,
Hello.
in response to the question that's showing up on my screen, it does mean that no treatment is required if symptoms are not severe. You recover spontaneously on your own like you will from any other respiratory viral infection in most people.
Hi, this is Pradeep here. I have a question.
Sure.
What about animals, pets, etc.? I know there's different people say that they can get it, they can spread it. Not so most of it I've heard is that they don't spread it. What's your understanding of that?
Same things that you're reading, Mr. Bua. That most sort of respected authorities and sites say that as of now there is no evidence of spread to domestic animals and pets.
Okay, and they can't themselves be carrier also, right?
Very difficult to say at this stage. Very difficult to say at this stage.
Okay. Okay.
We know that this is a zoonotic virus, which means that it primarily came from animals. But all zoonotic viruses may not be able to infect all animals.
But I've also read that this is not like a living organism. It's more of a DNA wrapped in some kind of a thin layer of fat somewhere I read, and that's why the soap and all can kind of do.
Yeah. So that's basically any virus, and that's what differentiates a virus from a bacteria. A bacteria is a single-celled living organism. A virus is just a sort of DNA particle which is wrapped in a suitable coat that allows it to transmit and spread, and so it's semantics what you call it or how you look at it, but it's capable of causing immense damage, as you can see. But you're absolutely right that that's the reason why hand washing and friction with soap and detergent is so effective.
Each you already said, I think.
Yeah, Dr. Yeah, Pradeep, go ahead. Any more questions you have?
No, I was just.
Can I speak?
There is a talk about having. There's a new virus, Hanta virus or something like that. Which has got, which is infectious and has got more, fatality kind of thing. So have you heard anything different?
Hantavirus is not a new virus. It's a virus that has been around for a long time. And from time to time, we have had sporadic cases of hantavirus even in India, parts of India.
Okay.
But I did read about some, sporadic thing about it, but nothing further regarding that. But yes, it's a far more dangerous virus than this one in terms of mortality.
But it doesn't. It's not as infectious as this one.
Yes.
Correct. Okay. Yeah.
Just in the interest of the room, can I request people to put it on the chat? Since so many people are there. Raja, I know you wanted to have a question, but there was one more question, Dr. Aayesha, on the temperature. So will summer reduce or kill the virus?
Again, I said wishful thinking. Let's hope. Let's pray. They're saying in a laboratory condition, the virus dies in 15 minutes at a temperature of 54 degrees. I can't think of any place in India where it would be 54 degrees. So But clearly they feel that the virus would be less viable in conditions of heat and humidity. And so, like with other viruses, the tropical climate is a good thing in preventing their spread. And let's hope that in some way it reduces the secondary transmission rate, and the RO, which is an epidemiological term for how many people get infected from one. Let's hope that our weather plays a part in that. But again, I mean, it's just conjecture at the moment.
I have one question. Hello?
Yes.
Yeah, as you said, this is can die in 15 minutes when there's a 54 degree.
Mm-hmm.
Now, as we don't have enough of this sanitizer and all this thing for the lift door and things like our doorbell and stuff. Mm-hmm. So is it like having the dry heat, like electric dryer heat and all these things to run through so we can take care of that part?
You can, but other community surfaces can just be cleaned with, your household bleach or Lysol or things like that. Those are effective.
Those are effective?
Yes.
Okay.
Yeah.
Okay.
There's
Because,
a list of them on the WHO and the CDC websites of household cleaners that can be used effectively. And there's Clorox, there's Lysol. Even if you can just make a bleach solution, they've shown you how to make a bleach solution. So you just make a bleach solution with 1:5 parts of water or whatever it is, and you can just lagao the regular pocha with that on whatever surfaces you want.
Okay. Because when we
Just
go
one
out
last
and
question.
come back,
Just one last question, Dr. Aayesha, which is on the smell. So certain reports are saying loss of smell is a new symptom. Is that true?
Yeah, even I've read that. We haven't had as much experience as the West to be able to tell you firsthand. But yeah, there are some cases of conjunctivitis, some cases of profuse diarrhea. Now they are saying loss of smell. So various things coming in. I hope we don't have sufficient numbers to comment on it ourselves. But again, this is just what we're learning from our colleagues in the West and in places that have it.
Dr. Aayesha, thank you so much for taking out time. I know you've been terribly busy, and Joy had mentioned that you will be able to spare only half an hour, but you've really helped this. So really appreciate it, Dr. Aayesha, and kudos to all of you for doing this great work. So thank you.
Thank you. Thanks so much.
Okay, thank you, everyone. We'll close the call now.
Thank you.
Thank you.